So it recently dawned on me that I've never made a full hip history video. And this dawned on me because I was getting my stuff ready for Marfan Syndrome Awareness Month, which is February. Going through my posts, what am I posting on what day, yada yada. And I realized that most of my hip information is in post form, is in written form, which is very, very hard to find and share. Whereas I have maybe 4 videos that explain what's going on during that time period, and that's a lot easier to share in a post. And it's also on YouTube. I do have a YouTube channel now called Marfan NWV. So I just wanted to, this video could be extremely long, but I'm going to try to dial it down so that you're not wanting to bang your head against the wall or stop watching. So I made a tentative list of the really important things, because if I put everything on here, like I said, you would get super duper bored. So we'll just start out with, I started having hip issues around like 10 years old. So that would be like around 1996-ish. And it started with just pain. Then it started subluxation, which is different from dislocation in that it just kind of goes in and out, in and out. As dislocation goes all the way out, you can put it back in. Somebody might have to put it back in. It varies in severity. So we went to the doctor then, and they diagnosed me with juvenile arthritis. Basically just said, take some medicine. nothing to do. In 2016, I was in physical therapy, aquatic physical therapy for my back, I believe it was. And some of the exercises they had me doing affected my hip, like side raises and front raises and all that. So that upped the pain from my normal. But in 2017, March 2017, first interstitial cystitis PT appointment that I went to. Interstitial cystitis is a bladder thing, right? When you do physical therapy for your bladder, there's internal and external. So you start with external and then move up to internal. So external includes like exercises like bridges and donkey kicks and side leg raises and Kegels and on and on and on and on. I left that appointment in horrendous pain. So I made an appointment with Dr. Castle. He's one of the orthos around here still. And I told him all of this. I have Marfan's, and what can we do? He said, honestly, you have Marfan's and it's going to get worse, and there's really nothing that we can do about it. He said, I can try to give you an injection in your side hip, because I had bursitis really bad, which is like a sac of fluid that gets, really inflamed. So he tried to inject it. It actually ended up making things worse. So he had already told me, hey, there's nothing we can do. So, okay, there's nothing we can do. My mom started having very bad groin pain, and she got an x-ray and a CT, and it came back as femoral acetabular impingement. So they referred her to see Dr. McCormick. That's where he comes into the story. When she went, I said, hey, I'm just wondering, would I need a referral to come see you? And told him like a brief synopsis. And he said, no, absolutely not. Just go ahead and schedule. So that takes us up to May, still in 2017. 2017 is a very, very long year. So he did a physical exam, which hurts extremely bad. Came back with the diagnosis of femoral acetabular impingement, the same thing that my mom had, and sent me for a CT. CT revealed that I had a labral tear. Your labrum kind of acts like a gasket in layman terms to, it like your bones, it's in between your bones to cushion them, kind of. So I had a tear from 12 o'clock to 2 o'clock. I think that might be backwards for you. I can't tell. So it's a pretty large tear when I didn't even know I had one. And that I had excess bone on my acetabulum, which is the socket side, and excess bone on my femur, which is your thigh bone. So this excess bone over here and this excess bone over here has been doing, instead of like moving really softly like it should, especially at 30, it was more like with every single step, therefore causing a pretty substantial tear. I didn't have groin pain, so I never really thought that it was the same thing, since Mom's main thing was groin pain. But that's what it ended up being. He recommended for her an injection. So I said, well, can I just get an injection too? It's like under ultrasound, so that it goes really deep into the hip joint rather than fairly topical, like an inch in, because that isn't going to reach your joint. He said, oh no, yours is way, way, way too bad for that. I'm like, oh, okay, well. And after somebody tells you there's nothing that they can do, and you've lived with this pain for over 10 years, you're only 30. I mean, I guess it was closer to 20 years at that point, I guess. When somebody tells you that they can fix you, it's like, oh, well, let's do it. Absolutely. He told me that the procedure was time sparing or something along those lines. Like, it would buy me time before I would need a hip replacement, because a hip replacement, as far as we all knew, is big surgery, and you don't do that at 30. So it's going to buy me time, right? And it's an arthroscopy, so that it's not an open incision, and it's just like 3 little portholes, kind of like they do gallbladder, just in a different place. It's in the front of your hip. And you know, it's going to buy me time, and it's going to make me feel better, and on and on and on. Of course I'm going to do it. I mean, so we get scheduled for surgery June 28th. Still in 2017, mind you. That is when my world changed in the blink of an eye, from black to white. Like 180 degree hit in the face, basically. Remember, the surgery is supposed to be fairly simple. The recovery is not. Recovery is actually 10 times worse in a normal case than what it would be with hip surgery, like a replacement, because that day you were up walking around, or at least the very next day, with a replacement. That's not the case with this. So they went in, they used 3 anchor stitches to sew up the hole or the gap, tear, whatever, in the labrum. He shaved off the extra bone over here. He shaved off the extra bone over here. And I think that was all in the first one. So pain was really, really, really bad. Somebody was supposed to come in prior to surgery and teach me how to use crutches. They didn't. I got there at 5:30 in the morning, left at like 3 p.m. So I didn't know how to use crutches already. So after surgery, here they come with crutches and say, here, take yourself to the bathroom. And I'm like, I don't know how to use those, and I can't use my right leg at all. No weight bearing at all for 2 weeks. And you expect me to get myself to the bathroom? I mean, it took forever for me to wake up. I was already nauseous. Like, I don't deal with really deep general sedation extremely well. So anyways, I was like, just go get me a walker and help me, because I really have to pee. So that's what we did. And he ordered a walker for us to get on the way back. Well, On the way back, my aunt and my mom were with me. And I have 1, 2, 3 steps going up to my house, either in the back or the front. So either way, there's stairs. Well, I couldn't put any weight on my hip at all. So I couldn't use the up with the good, down with the bad strategy of how they teach you how to walk stairs when you have a hip pain or problem, because I couldn't use that leg at all. So how am I supposed to get up these stairs? Well, my aunt, she comes up with the idea that the fire department is like 3 blocks from my house, and I pay city fees. I've been here 15 years. I've been paying it. So that, that's what they're for. So needless to say, I think there's 3 firemen that followed us here and carried me from the passenger side of the car into my bed, straight into my bed. I have pictures of it. It's kind of amusing. That first part of recovery, like the first, I'm going to go with 3 days, give or take, I could not move my leg at all on my own. Literally at all. My mom had to stay here, and if I had to use the restroom, I had to, even in the middle of the night or something, if she was asleep, I had to call her and say, hey, I have to go to the bathroom. So she would have to come in there. I would move. I sleep on this side, like here's where you get out. So I would move my good leg, my left one, out, and then she would literally have to pick my right leg up and twist me and put it down. And then I would have to hobble my way with my walker and her to the bathroom. In order to use the bathroom, I couldn't open my legs. I couldn't bend over. How am I supposed to wipe myself? So I had to have her stand there, and I had to hold on to her for dear life and like lean into her so that it didn't affect my hip whatsoever in order to pee. I couldn't even like brush my teeth because I couldn't even bend over even at all, right? So I had to sit at a certain angle when I was in bed. It's a very, very, very rough recovery, even if it's in a good situation. So July 17th, I start physical therapy. And I love my physical therapy people. That's who I did the aquatic therapy with. And I've went to him numerous times. Like, he is super accommodating for connective tissue disorders. It's not, oh, hey, your hip hurts. This is what we do for hips. It's, you have Marfan's. This is what we need to do differently. Tell me what you need, type of deal. So they're great. Start PT. The protocol was basically, you start with bridges. Well, the first several times, bridges means trying to pull your butt off at the table, but it doesn't actually move. And trying to use a recumbent bike, which is the one that sits back and not straight up. And that first time, I completely blacked out from pain. Because I have a tendency to push myself further than even what I know that I should, because, especially from trying to get better, why would you not do that? So it got progressively better until 8/21. So that's a little over a month. I went in that day, my quad, the entire portion of your front thigh was completely locked up. And I'm not talking like a spasm. Like, it stayed locked up for about 4 days. I could punch it as hard as I could and nothing would happen because it was just locked. It was the weirdest thing. So I had gotten more weak. My hip started catching. I almost fell numerous times because of all of this put together. So my therapist, Tim, he was like, look, you need to go back to your doctor. As for right now, we need to stop physical therapy. I don't know what's going on. He said, if you figure it out and all this stuff, then we can try again in such and such time frame. But right now, you're just causing more harm than good. Okay, I trust his opinion, right? So I go back to McCormick, and he's like, okay, well, you're having a lot of pain. And I'm like, No, I'm not. It's really not. I mean, it's not terrible at this point. It's, what are we, 2 months out? It's not that terrible. And he was like, no, based on your symptoms, you're having tremendous pain. And I'm like, oh. He's like, your pain scale and your pain tolerance is so intensely high that you're not actually feeling it. But I need you to stop before you hurt. And I'm like, but I don't hurt. Anyways, he ordered a CT. CT came back that both bones on this and this grew back. First he thought maybe he missed them. Later we find out in the story that it actually grew back, which it's not supposed to do because you shaved it for a reason. So on the 26th of that month, September, he did some, I started feeling like just odd, and I know my body really well, and so I had him do blood work, did an ESR, CRP, CBC. All of those levels were extremely elevated, and they're all markers of inflammation, infection type of deal. So when they came back, I went back on October the 3rd. We went over the results, and he was like, I think that we probably need to go in and do an aspiration, which in layman terms means you stick a needle in and pull fluid out, and then you test it. And possibly a clean out, depending on what that fluid looks like. And I said, well, what's the chances that you go in there in that one particular spot? Because you're not going to draw fluid in 6 or 8 spots in my hip. You're just going to do it in one spot. What's the chances that that area doesn't have infection? Even if it was like a 2% chance, like that's kind of silly to me. So had to have emergency surgery the next day, and it went from being an aspiration to a complete scope, because I said, you know, if I've already got this bone growing back and we don't know if there's infection, just go ahead and try to do a revision and get it all fixed in one fell swoop. So we did, and I'll have to post pictures in my comments because I don't have them out. They did a synovectomy. I had extreme synovitis. Like it says extreme and severe, and like all the fluid in the hip joint was super duper cloudy. Couldn't see anything hardly. Particles floating around. Pictures are gnarly. Then there was a lysis of adhesions, meaning that they got rid of adhesions, which is like scar tissue. I had a shit ton of scar tissue. Capsular repair, that is the thing that, well, encapsulates the whole, like all of your bones and all of that, so they had to repair that again. Tighten it, because I have Marfan syndrome. Then they had to do another femoroplasty, so basically take more bone off of the femur. Okay. As they're in there, they do an aspiration because the fluid looks gnarly, like I said. They do an aspiration, send it off, and it comes back positive for staph. I gotta show you these pictures. Hang on, because it's just too gnarly to not show you. And yes, I do have a huge book of everything hip related. Okay, so this is my first surgery. You know, you can see everything. The fluid is pretty clear. This is the burr. That's what he's shaving off stuff with. Okay. Now, compare that to that. That's what he saw when he went in the second time. That's blood. Very, very cloudy fluid. Over here we've got him shaving again, and the best part, this is dead tissue. I don't know if you can see it. It's black. That's necrosis, dead tissue. So when I saw these, I was like, oh Lord, that does not look good. He said he's never seen a hip that bad ever. Leave it to me. I dropped my pen for just a second. So, comes back staff. I go in on the 10th, October the 10th, still 2017. Excuse me. He says, you know, you have a staph infection. I'd like to just put you on some antibiotics. And I'm like, I would really prefer a PICC line. I don't even know how I knew about a PICC line, but somehow I did. So in order to get a PICC line, you have to go to the hospital and they have to insert it under ultrasound guidance. Like, it's a huge thing because it goes in here and it's threaded all the way through here and sits right at the top of your heart. And they deliver antibiotics to the top of your heart, essentially. Because if that infection gets worse, then you're looking at endocarditis, which means the infection around your heart. Very, very bad, especially if you have heart issues anyways. So they admit me for that. And 2 days later, still in the hospital, the thing comes back with MRSA. No one told me. A CNA that worked there randomly was putting something on my door, and I was like, it was like gloves and gowns and face masks, and I was like, are they like changing the location of that? Like, what are you doing? And she was like, oh no, you have MRSA. And I was like, excuse me, what? I worked in the healthcare field, right? I knew that MRSA was not good. Like, when we came out of a room with someone that had MRSA, you had to, I mean, really thoroughly clean everything and everything that touched them, right? Including yourself. So I was like, excuse me, what? No. And she was like, nobody told you. No one told me. So the next day he comes in and he tells me, hey, you have MRSA. You also have bacteremia. I'm not sure if that's how you say it or not. Sepsis. But then he was like, but I don't see how you have sepsis because you've never had a fever this whole time. And I said, I've never had a fever in my life. Yeah, but you have to have a fever to have sepsis. Okay. The blood cultures are saying that, though. Yeah, but you really don't look that sick. Okay, but the blood cultures are saying that. So anyways, they put me on vancomycin, which is a super, super, super strong antibiotic. Put it through my PICC line. The next day I get a TEE, transesophageal echocardiogram. Essentially, they do it just down your throat like they do an endoscopy, which puts it like right at your heart so that it's more efficient. And they were looking for endocarditis to see if my heart was infected. Wasn't, thankfully. So I get discharged that night. So I spent 4 whole days in the hospital. Home health comes in the next day. They're the ones that's going to be doing like my dressing changes, taking the blood that needs to continue to be tested, and bathe me. Because yes, we are, well, I guess at this point we're 2 weeks out. But even from the first surgery in June, I still can't get myself out of the shower. I have to have someone help me because I can't lift my leg. I have a PICC line in now, not now, but we're in October when I come back to do home health. I have a PICC line in, and when you take a shower with a PICC line, you have to wrap saran wrap from here to here, all around everything so that it doesn't come out, it doesn't get wet, it doesn't get contaminated, yada yada. So here I am, can barely use that arm. And then I can barely use my leg. So someone had to bathe me. There's no way I could wash all of this hair, maintain it all, wash my feet that I can't stand on my right one to wash my left. Like, it's a whole thing. Couldn't put my shoe on, couldn't put my sock on, couldn't put my pants on. They had me in support hose. Definitely couldn't put those on. So I had several different people coming in to help me. During this time, I was doing my own infusions, because this PICC line is, think of it as an IV line, how they infuse you with solution in that. But it was long, it had a tail like that would reach down here. And they would send me medicine in the mail, and I would just, it was like hour-long process maybe. I would have to do the antibiotic, saline, and heparin. Heparin is to make sure that I didn't clot off, and then that would be a huge deal. They have to start all over. It thins the blood, essentially. Okay. During this time period, I start having extreme back and leg pain. And we're not talking like back like your low back, where like straight down your spine. So not only can I barely walk, my hip hurts like hell. Now my spine hurts, and the rest of both legs hurt. So I call, and they're like, okay, well, that's not huge. Time goes on. We get to the 23rd of October. Wake up, and back here there is golf ball size lymph nodes. Like, that's not normal. So I call the infectious disease doctor, and he says, go to the hospital immediately. So I did, just thinking I was going to the ER, and I got admitted again because they called me a failed outpatient. Got admitted again. The 24th, he says, okay, you might have a spinal abscess. That might be why you have this much pain in your back and your spine. And I'm like, okay. So they do cervical, thoracic, and lumbar MRI with and without contrast. So it took approximately 4 hours in the machine without coming out, without taking a break. It was pretty horrendous. And I already had a migraine, so it was very bad. There was no spinal abscess. However, there was a shit ton of bulging discs and hemangiomas, which apparently hemangiomas are okay, and they're not super bad unless they're super bad. And I'm like, how do you know if they're super bad? Well, we'll know. So I have hemangiomas in my spine, and I guess it's okay. So the next day, okay, it wasn't a spinal abscess, so let's do another hip MRI. The thing to know about, we're in West Virginia. We're already behind the curve substantially. But the thing to know is we have two in my area, the greater Charleston area, we have 2 hospitals, Thomas and CAMC. As a rule, in general, CAMC is better. Thomas is, where you go, but my doctor was located out of Thomas, so I had to go to Thomas. When you get imaging done, same thing. CAMC has better radiologists and better equipment. Thomas is So all that to say, my hip MRI from 2 weeks post-op just came back as minor tissue edema, which is swelling. Are you serious right now? Because I'm 2 weeks post-op again. I still can't even move my own leg. I can't get out of bed. Every time when I'm admitted into the hospital, every time I have to go to the bathroom, I have to push the call button. Then I have to push the call button to get me back into bed. But there's just a little bit of swelling. Okay. So I finally get discharged on the 26th. So I was in there 3 days this time. So 7 days overall. On the 14th of November, I start getting this reaction all around where that PICC line is. And we're not talking like a red rash. Like, the skin was like peeling off. Very, very bad. Very painful. Very itchy. Not normal. So I call. They start freaking out again. Tell me to go to this infusion center because someone has to monitor me because I have to change antibiotics. And it's a whole thing. So anyways, I went from vancomycin, which is already strangely strong, to daptomycin, which apparently is what they use for leprosy. So then on the 17th of November, mind you, we're still in 2017. I had seen my doctor multiple times. He has no idea what's going on, why I'm not healing, why things are growing back. So he's like, okay, I went to school with this guy, and he does really complicated cases. He's near Cleveland. So I want you to go see him. So I get there on the 17th, and he's like, I've never seen a hip this bad. Like, there's so many issues, blah, 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 blah. And he hasn't even seen any recent imaging. He's only seen, like, when he tried to examine me and, like, move my leg for me, like manual circumduction. He barely got it off the table, and I was in so much pain I almost passed out. My cousin and my mom were with me, and she was like, oh my God, you need to stop. Like, she's turning completely white. I don't remember it because apparently I blacked out. Anyways, he sends me for an MRI, but tells me, hey, I want you to come up here to Cleveland Clinic to get this MRI, because I know our doctors, that our radiologists know what they're looking for. And our machine is so sophisticated that the Cleveland Browns use it, the Cincinnati Reds use it, and whoever their basketball team is. I don't know who they are. Cavaliers, maybe? Anyways, they all use this. So it's called a 3T MRI. At this time, it's the only one anywhere remotely around us, and it's obviously the best, which it was. Like, they gave me headphones. I got to choose my music. It was like a whole thing. It was cool. So it comes back, go back to see Laskovsky, that's his name, in Ohio, the 23rd. So 22 days later, I go back to Ohio. Mind you, Ohio, Cleveland, Ohio for us is about 4 hours. I can't sit that long. So we had to put the seats down in the back of my mom's car. She has an SUV. Get a cot. Lay a cot down, and I had to lay down and sleep the whole time, because not only am I in this much pain, but I get terribly car sick, and I have since I was a kid. So a 4-hour trip is a big, big, big deal. Not only that, but my mom can't drive that far because she has narcolepsy. So we have to have somebody drive us too. Like, it's a big ordeal to try to go anywhere outside of like an hour. And I still can't drive that long, so I still have to have at least someone. So we went back to Ohio again, and he comes in, and in the first couple sentences, he's like, you know, I every once in a while, I have that patient that I just can't help. And I'm like, okay. He goes on to tell me that, and he shows me the MRI, he pulls it up, and it reveals even more than what the radiologist found. Just to name a few, there was bursitis. He said rip-roaring bursitis. I had tendinitis in a couple different places. I had torn tendons. I had both bones grown back again, cam and pincher. They were both grown back again, as if they were never ever shaved. And I had fluid inside the top of my femur, inside the top of my thigh bone, where fluid is not supposed to be. So he says, you know, I really can't help you. The appointment was almost an hour long. Like, a lot was said. This is just a brief synopsis. But he's like, when it comes time for you to get a hip replacement, you have to go with the creme de la creme. You have to do this. Like, it's a major ordeal. And if it fails, or if you get sepsis again, we have to take the whole hip out, which leaves you with no hip for inevitable amount of time. So he says, until you can't walk at all, don't do anything else to your hip, because it could get worse, and hip replacements only last for a certain amount of years. I was 31, I guess, at the time. So I come back, my surgeon leaves the state. So my last appointment with him, he's moving to Wisconsin, and I'm like, I still can't walk. I want a walker. You can't figure out what's wrong with me. What am I supposed to do? That's all in a video. It's a very emotional video, because I know in the video, I watched it yesterday, I just kept saying, you know, it's just not fair. He's learned so much from me, but I don't get helped. His future patients get help, which is great, but I don't. You know, during this time period, he had changed his surgery technique. his recovery technique, his PT technique, and how he chose his patients to have surgery based on me. He's done, I mean, a multitude of these surgeries and changed it all because of what happened with me. So this day I'm like, you know, what have you learned from me? He said, I will never, ever, ever see a Marfan patient ever again. Our tissues just aren't reliable. And it's not just us. It's EDS, LDS, any type of connective tissue disorder. Our tissues are just not reliable. Like, our healing time isn't the same. It's not going to heal the same way. Like, my incisions are really wide instead of a slit. They're indented. Like, it's just, we're just not the same. We're very unique. So when he did both surgeries, he did three portals. Second one, he used two of them, but had to change one of them because the first time he cut a portal that cut my nerve. No big deal. No big deal. You touch that spot still to this day, and I get weird feelings all down the side. So he leaves. His PA is obviously still here, and the practice that he's going to, I'm like, well, I'm just going to follow you because I really don't want to start all over again. I don't want anybody to do anything to me or for me, so I'm just going to follow you just to, you know, do my yearly rounds or whatever. So I did. The doctor came in at this new office, and he's like, I can't help you. And I'm like, I don't really want you to. I just need a yearly MRI. So that's what we did. I got an EMG because they thought, okay, well, something is really wrong with this chick and we don't know what it is. And the EMG confirmed that he did cut a nerve. The guy it was a neurologist that did the EMG, and he was just complete, yeah. I couldn't lift my own leg off the table as it is. I might get an inch off the table, and that was like a huge accomplishment. So he has needles in my leg and applying pressure, and so obviously my foot is not coming off of the bed. And he's like, I know what the problem is. I'm like, you do? Because nobody else does. And he's like, you're just not trying. I was just like, I know you did not just say that to me. He did. He did. So, I went to a different neurologist. He was talking about regional pain, complex regional pain. Basically, it's this unidentified pain that nobody can explain or treat. And I'm like, yeah, that sounds about right. Get another MRI because I'll try to get a yearly one in August of 19. So everything that's always come back in the MRIs came back with a torn hamstring. Not completely torn, thankfully, but it was torn, which means I have to lower even a little bit of movement that I'm able to do. And red marrow hyperplasia, which is a bone marrow issue. My uncle died of leukemia, which is a bone marrow issue. And now I have a bone marrow issue, so I had to go to a cancer doctor. As if all of this isn't enough, I have to go to a cancer doctor now. So as far as that goes, he monitors me at least once a year, does this, looks at my MRIs. As of right now, knock on wood, it's okay. Sorry. Zoe, come here. So then I go to a different doctor. I'm sorry, I knocked and she thought it was somebody at the door. I go to a different doctor in Cleveland, another ortho. He gives me a hip brace, which is very, 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 very uncomfortable. But it does help. It goes around right here. It's like yay wide and very uncomfortable. I know at least one person that's got the same hip brace since, and she's very, very skinny, so might just be an issue that I'm overweight and all my rolls get caught. I don't know, but it's very uncomfortable. It does help. I've worn it since 2021. I get another MRI. Bursitis, tendonitis, tendon tear, labral tear. And all of this comes back in both hips. The other hip, the left hip, I haven't done anything to because hell no, nobody's touching it. But all of this comes back. So I go to Castle, which is who I started with initially, that told me, you have Marfan's. There's nothing we can do. It's going to get worse. Who was right in the beginning, before I had surgery. I go back to him. I see his PA. She's like, okay, well, you have a very complicated case. I'm not exactly sure what you want us to do. And I'm like, nothing. Nothing. Don't want shots. Don't want surgery. Don't want anything except a yearly MRI. And the only reason I'm here is to get my MRI this year, as of 2021, is because I had to fight like hell with my insurance to get it because my PCP ordered it. And they said, well, XYZ. And then this ortho ordered it, and XYZ. And then it was just a whole ordeal to get this MRI. So I said, I'm here to get a yearly MRI. Like, you don't even have to read it to me. We don't even have to make another appointment for you to go over it. Like, I can go over it. Just send me the results and we'll go from there, as long as it's not anything horrible. We're just in a monitoring game here. Like, I don't want anybody to do anything until I absolutely have to, including injections, because remember, that injection made me worse before I had surgery. So for at least a year, couldn't put my own sock on without an assistive device. Couldn't tie my own shoes, so my occupational therapist figured out a way to do elastic bands that tightened, and all I had to do was slip it on, slip it off. So I was able to put my own shoe on. Couldn't shave my legs. Well, leg. I could shave the left one just fine. Couldn't shave my leg. For a great majority of the time, I couldn't get out of the shower by myself. I had to get a fall alert system. I got the brace. I had a walker. And I had a walker up until the beginning of this pandemic. And I still need it probably to feel safer out in, in stores and stuff like that. But it initially started because at the beginning, fomite transmission, which is like touch transmission, was thought to be a spreader. So I thought, if I have to clean this walker every single time I go somewhere, like, this is a huge pain in the ass. So I'm going to try to just use my brace and the cart at the store, and there's always somebody with me. So I finally got off my walker in 2020, like April or May of 2020, from 2017. Now, here's this 30 XYZ, I'm 35 now, 30-year-old with a walker and a hip brace. So you can imagine, and I also have a wheelchair, by the way. You can imagine the looks. I don't care. I'm not vain. That doesn't bother me. But when people come up to you and they say, what happened to you? That is so rude. It's none of your business, for one. And what if I was born this way? You don't know. Like, you don't know who you're asking what to. So I would just say, I had hip surgery. Oh my God, you're too young for hip surgery. I know. Or I have Marfan. What's Marfan's? I mean, like, it's a never-ending cycle that everybody is far too inquisitive. I shouldn't even say inquisitive. They're too nosy. Inquisitive is a good word. Nosy that's what these people are. I went to aqua aerobics at the one of the community centers. All old people. And I couldn't do 95% of it, even though it was in water. And they kept saying, why can't you do that? Just try this. Maybe it's this. Well, Bobby Sue down the road, she has XYZ, and she can even do this. And it's like, why? Why are you talking to me this way? What gives you the right, you know? All of that to say, watch what you say to people. You know, when somebody's already going through all of this, and you random stranger just come up and start talking shit that you think is nothing, might be very well something. Yeah, it's been, I guess, June will be 5 years. Is my life anywhere near in the realm of normal? No, absolutely not. I used to go to 5 or 6 concerts a summer. I can't. I used to go to 2 or 3 football games a fall. I can't. I could go in my wheelchair. Somebody had to push me, and then this, and then that, and it's not worth it. Or if I go to a concert, and then how am I getting to the bathroom? And a cart has to come pick me up, and then I'm in handicap seating, and then what if a drunk runs into me? And if I fall, it's very bad. I actually did fall twice last summer. Somehow I did not damage my hip. Thank God. I damaged just about everything else. Fell on stairs because my leg went out. So even we're coming up on 5 years, I'm not the same person. You know, with a chronic illness in general, just having Marfan in general, you go through a grieving process constantly. Like, it's just a cycle that just keeps going and going and going. That was manageable, but this, it was completely life-changing for me. Completely life-changing. Like, I couldn't drive. My mom had to sell my car. I had a Honda Accord. She had to sell it because I couldn't sit down. She was driving it. I couldn't even get down in it. So we had to get a Jeep, pretty tall Jeep, that I could actually get into because I couldn't. I had to pick my leg up and pick my leg out. And the accommodation that you have to make for a hip-related issue is something that you will never, ever understand until you have to go through it. You don't realize how much you use your hip for everything. You have to change the way you go up and down stairs. It's a lot. It really is a lot. I've tried my best to advocate against this surgery because if you go on the bigger groups, there is so many people, especially with connective tissue disorders, mainly EDS, that fail. And it's mind-boggling to me because these people that fail think they don't fail. They think it's a success. And you say, well, how many surgeries did you have? 7. You have 2 hips. If you've had more than, I'll even give you a revision on each. If you had more than 4, it's not a success. I know someone that doesn't have a hip at all, that's had like 25 surgeries. This procedure that is supposed to buy you time and save you from a hip replacement, and, you know, for a lot of people like athletes, it's supposed to give you your life back and all that, damages you, handicaps you, disables you, deforms you, when you could just wait for a replacement and fix it all because you get all new parts. So I try my best to advocate anybody that has this. It's very, very common now. The arthroscopy is for femoral acetabular impingement. Arthroscopy, super common now, and I hate it. I tell everybody, you know, in the brief version, basically I was on a walker for 4 years when I just had hip pain going in. I went to, me and my mom went to a local restaurant a couple months ago. Had my hip brace on, and this server comes up and she goes, "Oh my God, my sister had that surgery. She has that brace." And I was like, "What?" And she goes, "Yeah, it's a hip arthroscopy." And I was like, "Yeah." Goes on to tell me that her sister was 21 at the time. She's had three or four surgeries. Of course, that means failure. Still can't walk. Still wears a hip brace constantly. And her surgeon left. And I said, "Is his name McCormick?" And she said, "I'm not sure." And I said, "Tall, nice." And he left. Yeah. We had the same surgeon. So how many people are messed up just around here? I know of at least 6. And everywhere is doing that. It's not okay. It's really not okay. So I'm sure I've probably missed things, but just to sum up the story, I had hip surgery in June of 2017, which then led to another one, which then led to sepsis, which then led to a complete life-altering change that will never get completely better. No matter what, I'm not going to be the same person. Even if I was physically, which isn't going to happen, I wouldn't be mentally. I wouldn't be emotionally. It was very, very traumatic to go through all of that. Especially, what was that, 6 months that 95% of that stuff happened? It's very traumatic. So I implore you, if you have hip problems, especially if you have a connective tissue disorder, please don't do this. If you want to reach out to me, I'm on Facebook. My group is called Marfan NWV. I'm on YouTube, again, Marfan NWV. Instagram is Lindsay723, I believe. Reach out to me. I don't care to talk to you. I've been through it. You know, if I was able to help people by changing the techniques that my doctor used, he told me before he left, he said, "You've helped thousands of people. You know, I do conferences and now I'll tell them this story, but I might be able to help you. So if you see this, please reach out to me or someone. There are groups on Facebook. Most of them think that they are a success when they had 7 surgeries, so I don't necessarily recommend that. But that's my hip story. So thank you for listening.